Good morning and welcome to Community Network, a network that connects people in the community to resources they need to improve their overall quality of life. We address issues related to health awareness, educational growth, economic development, community service activities, cultural appreciation, and volunteerism. We invite you to find your place in the wheel of Community Network by contributing your time, talent, treasure, testimony, temple, and trust. Give us a call at 904-635-5191 or 904-766-9955. Today, we have with us Dr. Katherine Hicks. Good morning.
Good morning.
Dr. Hicks is from Great Expressions Dental Center, and this morning we're going to be talking about oral cancer since this is Oral Cancer Awareness Month. Now, Dr. Hicks, you want to tell us what are some of the reasons that this is important to talk about?
Well, oral cancer is very important because it comprises about 85% of all the head and neck cancers. There is a 5-year survival rate of oral cancer, so it's very deadly and it's being detected very late. So the survival rate is very low because it's being diagnosed in the later stages. So it's very important for us to screen and try to do as much prevention as we can.
And like with most cancers, early detection is very, very good for survival rates being increased.
Absolutely. So if you detect it early, then the treatment is more mild and they have a higher survival rate, and they don't have to be, if they catch it in the later stages, not only is it life-threatening, but it can be disfiguring and it can affect their speech, and it can be disfiguring as well.
So what is oral cancer?
So oral cancer, it is a type of cancer. The way that it can present itself inside the mouth, it can be a white lesion, it can be a red patch, it can be a lump or bump. If you see anything that and any kind of sores, mouth sores that don't go away within 14 days, we want to make sure that you get that checked out. It is not normal to have that in your mouth for over 14 days. The mouth is an area where it heals very fast, and you should not have any lumps or bumps or sores in your mouth that last for a longer period of time.
Okay, now tell us, what are the signs and symptoms of oral cancer?
So some of the signs and symptoms, sometimes cancer can hurt and sometimes it cannot hurt. So you can have a lesion inside your mouth that doesn't go away. You can feel a lump or a mass. Anything that interferes with swallowing or your speaking or chewing. If you notice a hoarseness in your voice, or even if you have any numbness, or diabetics, they get numbness or tingling in their extremities. If you have that type of a sensation inside your mouth, that's not a normal thing.
Wow. Now, it seems like there should be some way to prevent oral cancer from occurring. Can you share with us some of those ways?
So as a dentist, we provide oral cancer screenings to our patients, and because it is Oral Cancer Awareness Month, we are offering through Great Expressions free oral cancer screenings this month to all of our patients. And basically what we use a technology called Oral ID, and it doesn't hurt to use it. It's a 2-minute screening, and it uses fluorescence technology, and basically we shine a light inside the patient's mouth, and the healthy tissue will reflect the light and it'll bounce it off the tissues. And if there's any abnormal tissues, it will not reflect the light, and it will show it as a dark lesion. So we have the ability to photograph that as well. And then if we find any pathology, usually we'll refer you to someone like the oral surgeon, and they will do a biopsy. And we can catch lesions this way that are precancerous or cancerous, and things that we can't see with the naked eye.
And we were talking earlier about the cliche or a motto for April screening, and shine the light, save lives.
Absolutely. Shine the light. So we are here to shine the light today. We want to inform everyone about it because cancer affects everyone in our lives. We all have a family member who's been affected by it or a friend. It's something that's near and dear to our heart. So if there's something that we can do to prevent it, we want to make sure that we can do that.
And that would help us to smile a lot more too, because, we have this expression that you look so much better when you smile.
Absolutely.
And you're not afraid to smile when you're not hurting, and your teeth are shining, and you are actually saving your own life in the process.
Absolutely.
This is wonderful. This is so wonderful. And you said that these screenings are free for the month of April. Now, if I wanted to receive one of those free screenings, what number should I call?
You could call our office at 904-821-9555. That's the San Pablo location, but you can also, that's where I am located at, but you can also go onto the website at greatexpressions.com, and you can, we have 25 offices here in Jacksonville,
25?
Florida. 25,
wow.
Yep. We are a proud dental group, and we're proud to service the Jacksonville community. And we provide comprehensive and affordable dentistry to our patients and quality care. All of our doctors are part of the American Dental Association. They're members, and we have all the specialties in our group as well, which is a great thing to be able to offer our patients. But we have different locations, so we're easy to approach, and you can find a location that's close to you.
So accessibility is not a factor when it comes to receiving dental care.
Absolutely.
Now, what about insurance? Do you accept most insurance, or is there any insurance that you don't accept?
We accept most major insurances. There are few insurances that we don't take, but for the majority of the insurances we do take. So we are very accessible to our patients.
And so one easy way to determine whether or not your insurance is accepted is by calling 904-821-9555. But the free screenings for the month of April, you need to call and book those early, because you know that every time we have a free service, everybody is trying to get in during that month of April. But during the screening, there's also an opportunity to talk about more ways to help people save their teeth, protect their teeth, prevent oral cancer from occurring. And that's so important during this month. What have you noticed about the Jacksonville community and oral cancer? Is it more or less than other areas? Or what have you seen?
I think we're about the average. I have had some patients with oral cancer where they have had to have resection of their jaws, or they catch it late. And I treated one time a patient. He had a tracheotomy, and he had to get basically you have to get your dental care before they do the radiation or chemotherapy, because then your immune system is lowered and you're at a higher risk for infection. And then with the radiation, you have a higher risk of getting osteonecrosis, which is the bone dies and the blood vessels they don't supply as much blood to the jawbone, and you have your healing rate is much lower. So if you need an extraction at that point, then it's harder to heal.
Okay, now I noticed that you have a little device with you, and our listening audience can't see it, but they can hear the effects of it. And sometimes when you have oral cancer, it impedes your speech. Mm-hmm. So people have a speech impediment. You want to give them a sample of how that might sound if this should occur. First, explain to them what you're doing, and then do it so that when they hear a strange sound come across the air, they know that we're not disconnected, but we're actually trying to show you what are some of the long-term impacts of not being treated.
Right. So what I have, it's cheek retractors. And so it retracts the cheeks and you can kind of see the teeth better. But it does affect your speech and how you sound. So I didn't have any Baileys in my morning coffee, I promise. I promise. So I'm going to insert this in my mouth.
Okay, she's putting it into her mouth. And now we're going to ask her a question.
Okay.
Dr. Hicks, how are you feeling today?
I'm feeling great.
You're feeling great. You're having problems speaking this morning. What seems to be the problem?
I have these cheek retractors in my mouth.
Why do you have teeth retractors in your mouth?
I'm trying to get a point across.
You're trying to get a point across. Is that right? And sometimes when we don't go to the dentist when we should, because we're afraid of the dentist, then we have something more to fear, and that's long-term results of not being treated. Now, how many people go without treatment for a long period of time?
I'm really surprised at how many people don't go to the dentist.
I would be surprised at how many people don't go to the dentist. I'm repeating what she's saying because I know it's difficult for you to hear. But this is what happens when you don't go to the dentist. And people should go to the dentist at least twice a year. And sometimes 4 times a year, depending on the condition of your mouth. Now, I'm going to let you take those out right quick because I know it's very difficult to have those in for a long period of time. And when people go to the dentist more frequently, they become less and less afraid.
Absolutely.
And as we take our children to the dentist early,
right,
they learn that the dentist is their friend.
Right.
And when you have poor oral health, it impacts your eating as well.
Absolutely. It's not just the cosmetics and the how your teeth look and how you present yourself in society, but it affects your nutrition and it affects how you your phonetics, how you speak and talk in front of people. So it's a tie. Anxious patients, we try to ease them into the office and into the dental treatment, and we'll hold their hand a little bit if they need a hand holder and a little extra TLC. We'll try to do that for them and guide them through their procedures.
So there's really no need to fear.
No, dentistry has changed a lot over the years, too. I don't think I would be a dentist back in the old days. I'm not a huge fan of pain. I want our patients to have a great experience and so that they can go and tell their friends and stuff as well. And they can tell their kids, too, because we transfer our anxieties and fears to our children, too. So
Yes, we do. And that is really so important that the family receive dental services. And the earlier, again, the better, because we know that oral cancer is preventable, and that means that we all have an opportunity to go. Well, Dr. Hicks, it's really been a pleasure speaking with you this morning. Again, for those of you who missed the number for the free screening for the month of April, that number is 904-821-9555. And there are 25 offices all over the city. And the important thing is that even if you can't get to great expression, that you do get a dentist, because we want to prevent oral cancer from occurring, especially during this month of oral cancer awareness. You have been listening to Community Network, and our guest has been Dr. Katherine Hicks from Great Expressions Dental Services, and this is Oral Cancer Awareness Month. Community Network addresses issues related to health awareness, educational growth, economic development, community service activities, cultural appreciation, and volunteerism. We invite you to find your place in the wheel of Community Network by contributing your time, talent, treasure, testimony, temple, and trust. Give us a call, 904-635-5191 or 904-766-9955. Become a part of a network that makes a difference. Become a part of Community Network, where we realize how good it is when brothers and sisters join together in unity for a stronger community network. God bless you. We'll speak to you again next week on Community Network.